Welcome to All Things Cardio-Oncology. My name is Steve Casselli. I'm the Executive Director of ICOS. And in this podcast, you'll hear from a diverse representation from our community. We want you to be both informed and inspired by their stories and experiences, and we're so glad that you've joined us today. Yeah, we're here at the San Antonio Breast Cancer Summit in 2023. I'm here with my colleague Dan Lenihan and with our friend Prince Otchere, who is working here at UT Health San Antonio. And we had a dinner last night that Prince helped organize for the meeting. Great time with friends and colleagues, new and old. And we wanted to hear a little bit more from you, Prince, about your background. Tell us a little bit about your medical background, and then how you got interested in cardio-oncology, how you ended up here, and then we'll talk a little bit more about the work you're doing, in your homeland as well.
Thank you so much, Steve, and thank you so much, Dan, for inviting me for this podcast. So it's really a privilege to be in this space, working with you guys who have been doing it for a long time. So my interest in cardio-oncology actually starts in undergrad. So it wasn't really cardio-oncology at that time, but it really morphed into cardio-oncology. So I studied molecular genetic technology at MD Anderson Cancer Center. Now, before going to MD Anderson Cancer Center, I've always been interested in the heart and hypertension in minorities, in black people. Why are my parents, hypertensive? Why do people in my family and other people who look like me have, heart disease? But molecular genetics sound appealing to me, so I ended up there. And being in that space at MD Anderson, cancer just rubs off you. You just learn a lot about cancer genetics. And so during that time, I was introduced to the concept of personalized care. And it was just so fascinating. So going forward, I was always looking for opportunities to marry the concept of the heart and genetics and cancer. I at that time didn't know anything about cardio-oncology, but it was something that it was in my mind. So went to medical school in Loma Linda. Really didn't have that much exposure, but it was at Kettering Health in Ohio where I met a gentleman called Dr. Bush. And basically, really fun guy. It's like, hey, Prince, what are you up to these days? I'm like, well, I don't know. You tell me. And basically told me about cardio-oncology. And in his words, my eyes lit up. Now, I don't remember that, but that's what he said, my eyes, because right there I could see everything that I was interested coming together. And so I started shadowing him, started going to the ICOS Thursday webinar. And I think those days there were maybe 6 or maybe sometimes 7 people at that meeting and on virtually. And the content was just appealing to me. Going to his clinic and see the patient population was just really, I just could see myself. And one thing I would say is that just the care that he provided for those patients was just different. He understood, and I came to understand that patient population is special. You just can't treat them like just any other cardiology patient. They are tender. They have received a diagnosis that sometimes changes their world. So you really have to just change the way you approach them. Marry the knowledge of cancer and the knowledge of cardiology, and make the best decision with them, not just for them, and with the oncologist, and arrive at an outcome that they can accept. So that's my background in cardio-oncology.
That's great. Tell me again, what was the name of the physician you worked with?
Carl Bush, and I think Dan knows him.
Calvert Bush.
Yes.
Okay. He's in Dayton. Yeah.
Okay.
Yeah. No, I've known him for quite some time, but yeah, he sounds like he was a really big influence. So that's great.
Definitely is.
Yeah. So cheers out to Calvert for doing that. Yeah. So I think that it's interesting, how we I don't know if we wander into our space or if you charge into your space. I don't know which one it is, but my early years were also formed at MD Anderson, so I was there for about 8 years. And as a cardiologist at MD Anderson, you kind of wonder, why am I here? And then when you finally realize there's so much that you could do, then it's like you don't have any questions why you're there. You're there to help patients through these really tremendous struggles. So yeah, you're right. I mean, what you said about your approach to a patient who's undergoing treatment for cancer really has to be different.
Yes.
As a cardiologist who's seen any range of patients, you're right. I'd say you pretty much nailed that one. That you have to have a different mindset.
Yes.
And so that's really fascinating. Well, tell us about what you're doing right now here in San Antonio. So, the San Antonio Breast Meeting is an extremely important meeting for the world of treatment for breast cancer. And, you happen to be here, so that's good. And you're trying to integrate into their true multidisciplinary approach. So what's your experience there? What's happening?
Well, thank you so much, Dan. So I am currently the director for Cardio-Oncology at the UT Health San Antonio, the Mace Cancer Center, which is an affiliate of MD Anderson Cancer Center as well. I came to actually start the program and, with the vision that any cancer patient should have their heart be examined, at least risk stratified, to see if there is a potential for disease, or they already have disease, and how do we approach that? So about 2.5 years ago, we set up the program, and it is doing really well. Interestingly, the South Texas area, it's a large area that didn't have an academic program like this, and so we have been making a lot of inroads, educating oncologists, not only in the UT Health, but in the South Texas, the Valley areas, and so we are doing a lot of good work there. We are not done, because we still have a lot more education to do, not just for the oncologists, but like the radiation oncologists, the surgical oncologists, the residents, the fellows, to let everybody know that this is an important thing. Now, the SABC is a large symposium that is put out every year around this time. About 8 to 10,000 people show up every year. Well, what an opportunity for us to leverage our presence here, to not just to meet and fellowship with one another, but also invite local oncologists, invite residents, fellows to educate them about what is going on in our space, and also engage more oncologists. So yesterday we had a meeting, which is the second meeting that UT Health and ICOS held, to really discuss the new guidelines. Well, it's not new anymore. Last year that was published, to just discuss, and also just make it aware to oncologists who may not even be aware that there are some guidelines that can be helpful in the way we treat our cancer patients.
Yeah, I think the guidelines, they've been out for a year or so, but especially to large portions of the cancer treating physician world, it's an unknown entity. So I think whatever ways we can help to try to improve the incorporation into practice is really important. Can you also, I know you have a lot of personal interest in what's developing in Ghana, and could you tell us a little bit about what's going on there?
That's a wonderful question, and so even from back in when I was a fellow and when I started the program, so this is an area that is about 60% Hispanic, and so it's a majority city. Not just San Antonio, but the whole of the South Texas region. So education education levels are not very high. Socioeconomic status is a little on the lower side, and it kind of reminds me of Ghana a little bit. Ghana, there are pockets that are developed, but the vast majority of the country is very similar to the South Texas area. And so when I see patients that have adverse effects from cancer therapy and they didn't know about it and nobody told them about it, sometimes it reminds me what is going on in Ghana or just Africa in general. Now they are seeing me, I'm able to help them, but what about them? Who's helping them? So really that was something that has been coming to my mind. But it was at last year's meeting when I saw a map that Susan Dent showed, and I saw that there really wasn't a lot of programs except South Africa where there was a Cardio-Oncology society, and I realized that something needed to be done. So it was there that I opened my mouth and said, we need to change this. But well, who is going to change it? Change needs to come from somewhere, and sometimes making those small changes, it's small steps is what you need to do. So 2 months ago, I had opportunity to travel to Ghana to start the first Cardio-Oncology, launch Cardio-Oncology in Ghana. And it was wonderful. We had stakeholders in the healthcare sector, oncologists, cardiologists, many other people from the capital, but also from Kumasi, the second largest capital, come to Accra and meet together. And we had international speakers. You were there then, and you did a wonderful presentation. We had also Susan.
Unfortunately, that was virtually.
That was virtually. Yes.
I would have preferred to be in person.
Yes.
But yeah, no, that's. It was a great meeting. Really, you could just tell the feeling in the room was so positive, and people were really excited about getting together and learning how to improve their practice. So
don't worry, next time we will get you there in person.
Yeah, no, that's fine. I'm happy to be a part of it, and if the way it worked is that it was virtual, that's great. I'm good with that.
Excellent. So as a follow-up to the meeting that we had in October, we have 3 things that we want to do. We want to form a Ghana Cardio-Oncology Society that will integrate into the main International Cardio-Oncology Society. That will provide for a framework for exchange of information, ideas, and the second thing is that it will be the body that will help Ghanaians in Ghana to be able to learn about cardio-oncology and also fellows and other things. The second part is trying to help at the very for the first phase, the big academic institutions like Kolebu Hospital and Konfanochi Hospital to have cardio-oncology clinics. And so we recently met with Konfanochi Hospital, and we are developing number one, assessing what the infrastructure looks like, what the environment looks like, and what they currently have, and to develop business plans and to be able to start a clinic there. And so hopefully the same thing can happen in Kolebu Teaching Hospital, which is in the capital of Ghana. It's where there's a large population, and definitely this will be needed. So there's a lot of work that needs to be done, but I think it's important, and we should definitely move ahead in what we are doing.
And how do you think the International Cardio-Oncology Society can help you? What ways can we facilitate these types of activities?
I think that's a great question, and I think what we actually did on that day when we launched was, number one, is being there, being present, and people knowing that, well, there's not just International Cardio-Oncology Society, they're actually willing to help us, to educate us. And the second thing is what we are already doing, actually being there for these smaller meetings to actually help build up the programs. And I think Steve and Susan have already exchanged giving resources on how to build these programs. I think that one of the things will be to guide the new programs in maybe helping protocols that can be tailored to the environment and the resources that we have. I think that will be another thing, but also just at some point just being there in person for like a day or two, a big seminar that where we can be there in person will be something that in the future I think we should do. But I think I did mention to Steve there is a big cancer society called Aortic, which really brings all cancer providers, not just providers, but anybody interested in cancer in Africa. It meets every 2 years. And so I think that will be a place for ICOS to be. I'm not sure where it's going to be in 2 years, but imagine everybody who cares about cancer in Africa being in one place and we being there as well. That would be a place where everybody would know who we are and learn what we are about and how we can help cardiovascular outcomes in cancer patients.
Super. Those are big plans, but that sounds really important. So we'll follow through on that, I'm sure. But Prince, this has been awesome. We so much appreciate your efforts here in San Antonio, and we look forward to next year during the San Antonio Breast Meeting, and who knows what we'll come up with, but I'm sure it'll be interesting.
Well, thank you so much, Steve, and thank you so much, Dan, for your mentorship and for giving us young cardio-oncologists the opportunity to flourish in this space, and just grateful. Thank you.